Hello and welcome to my channel. In this channel, we explain various nursing concepts in a simple form for a better and easy understanding. These videos could be used by both LPN and RN students as well as nurses who are trying to refresh their basic concepts. My name is Nurse Mosh. Bariatric surgery. Bariatric surgery is normally performed on morbidly obese patients, and when we say morbidly obese, this is by your doctor's discretion. So there's no set weight that they say this is when we can only perform bariatric surgery. There are various types of bariatric surgery, but things that you need to remember or need to know with bariatric surgery is the patient's feeding and what's to watch out. So with the patient's feeding, this is after surgery, we need to make sure these patients are eating nutrient-dense foods only and avoid things like milk, sweets, or high sugar, because this will lead them to dumping syndrome. Remember, with bariatric surgery, the patient's stomach has been reduced in the size, so it can only take a certain amount of food. Okay, so we have a smaller stomach. Let's eat these nutrient dense foods first, because that's beneficial to your body. We need to heal the body, because surgery is trauma to the body, so we need to replace the nutrients to heal the body. We encourage these patients to eat 6 small meals during the day. So 6 small meals are better than 3 large meals, because even those 3 large meals, they can't take it. Most of the patients, when they try to overeat, initial stage, it will always come back out. And when they're consuming these meals, no liquids, no water, no juice of any kind. We eat our nutrient-dense foods first, taking our time between 30 to 60 minutes with each meal, and we can have our liquids in between the meals. So for example, you eat at 8:30, your next meal would be maybe, let's say, 11 o'clock. So in between there at 9 o'clock, you can drink your liquid, but initially they are only restricted to 30 ml of liquid per consumption. And always remember to watch these patients for signs and symptoms of dumping syndrome. These signs include tachycardia, hypotension, diarrhea, nausea, diaphoresis, and abdominal cramping. Because if they are dumping the food, then they are not getting any nutrients at all. So we need to watch out. GI series. So GI series is a GI procedure that helps us to identify abnormalities in the GI system. This could include things like obstructions, tumors, or even ulcers. The patient in this procedure, the patient will drink barium, and an x-ray will be taken as the barium moves throughout the GI system. So with this procedure, we have prep, which is preparation before the procedure. The patient will need to be on a clear diet, so clear, with no food, just clear liquid. They need to be NPO after midnight, and they should not chew any gum or even smoke prior to the procedure. After the procedure, we teach the patients to drink a lot of water, flush out the barium, and then always let them know that their stool will be discolored. It will be whitish, but this is due to the barium they consumed. No alarm. This could take between 24 to 48 hours before their stool clears and goes back to the regular colonoscopy. I'm sure most of us have heard about a colonoscopy. So a colonoscopy is a scope procedure. This is where a scope is placed rectally to visualize the patient's anus, rectum, and their entire colon. When we talk about the entire colon, you are talking about your sigmoid, descending, ascending, as well as your transverse colon. It is done under moderate sedation, and prior to this procedure, we have the patient be on a clear diet. They take laxative to clear the bowels, and they need to be NPO after midnight the day before the procedure. And for a colonoscopy, always remember, since the patient is on a sedative, we need to check about, the sedative is out before we give the patient anything. And this, we check for the gag reflex, okay? So just don't give somebody fluid after the colonoscopy and they're still under sedation. Be careful. EGD, endophagogastrioduodenalscopy, long word. This is when the scope goes down the throat and we visualize the patient's esophagus, stomach, and duodenum. The patients, they do not need to be on a clear diet with this, and they do not need laxative procedure, but they do require to be NPO for 16 hours before the procedure. Remember, we are going through the esophagus, right? We're going from up down. And whenever you're inserting something from up going down, there's that risk of aspiration. That's why we don't want them having anything for at least 16 hours. Sigmoidoscopy. So sigmoidoscopy is where we visualize the patient's anus, rectum, and sigmoid colon, right? The part of the colon. It goes up because anus going up, not down. There's no anesthesia required for this procedure, but we normally have the patient do a bulb. Thank you for watching. Please like, share, and subscribe to my channel. See you on the next one. Bye.